I think, though, that we're going to start seeing our cases go up some in both the state and also in our area here. And it will be for several reasons. One is that, as most people know, we're relaxing here in North Carolina our restrictions, particularly in those areas where infections are at higher risk. So our restaurants now are up to 75% capacity, bars to 50%, and the bars will be open longer now. 11 o'clock alcohol sales has been the curfew for that has been lifted. So these are areas where people get together indoors and in oftentimes smaller places. And we know from case control studies that the risk of getting coronavirus in such a setting, at least in a restaurant, is about 2 to 3 times higher than in a retail establishment. And then in bars, it's going to be even higher than that, particularly bars that aren't following through with their capacity limits. And that group of people who tend to go to those areas are people who largely haven't been vaccinated yet. Either their priority group hasn't come up yet because they're young and healthy, or they're not interested in getting the vaccine. And so that group of people is going to be a group of people that are going to be driving, I think, an increase in cases. Will this be like it was in January? No. I think it'll be more of a small wave, whatever you want to call an increase in cases, compared to like what we saw in midsummer of last year. Now, our mass gathering limits have also increased in North Carolina, 50 indoors and 100 outdoors. So 100 outdoors, you gotta have a really big barbecue in your backyard with 100 people. But what this puts us into the realm of, I think, people thinking about having weddings and outdoor weddings and inviting larger numbers of people. And if you're thinking about having a large outdoor gathering with that number of people, there'll be unvaccinated people in that venue, I'm sure. So you'll want to be wearing masks and spreading out and thinking about how you serve food and how the eating is done, because when you eat, you take your mask off and infection risk goes up. So still be mindful, even though we're having larger groups of people together, be mindful of COVID safety. I still think that by the time we get to June, pretty much everyone who's going to wants to have a vaccine will be able to get it. And then the hard part comes in, and that is talking to people who haven't quite made a decision yet or are hesitant to get a vaccine. Answering questions, make sure they know, about the safety and efficacy data from the vaccines, and answering their questions that might have to do with a lot of myths that are out there about vaccines, and then also keeping up increasing access so that people have a chance to get it, even if they don't have transportation or maybe older and can't get out of the house so well. Our priority groups will be extended again on the 7th of April to include congregate settings, such as people living in dormitories or living together in group situations. And then pretty much anyone who has a job of any kind would be eligible for the vaccines.